right? So today we will see why sir does the clinical examination, how he does it. If we look at what sir does, we feel like it's like a allopath doing a clinical examination. ये पैर उठाया, ये पेट चेक किया, ये स्टेथो लगाया, ये टॉर्च मारा, and he's seeing what, when you see, it feels like it's an allopath doing a clinical examination for a patient. Now, how do we interpret what he's doing in Ayurvedic terminologies? So today, sir will explain what is he doing when he does the clinical examination. Sir?
Yeah, Hima, how is it? Is it audible enough? No?
Better than
no. Is it manageable? Is it manageable? Like if it is spoken this loudly? Because
yes.
I don't think so any other device is good enough for now. Perhaps we'll check on it later. Is that okay?
Yes. Sir, video खाली on થઈ શકે તો જો ને.
Now?
આમાં હું જ નથી આવતો એમાં.
સર અમે દેખાઈએ છે ને.
તમે લોકો દેખાઓ છો.
Can you guys see him?
Yeah, we can see him.
Okay, our screen does not show anybody else, so yeah. I mean, everybody's seen, but not him.
What you can do is you can log in from another device so that at least he can see other people. If you put it on a grid view.
That will grid means we can see 6 people, but not us. So
no problem. So,
you can just, I think abhi tak audio theek raha, so you can carry on.
No, वो लगा ना.
Not the new device.
બીજા કયા ડિવાઇસ પર કરી જવાનું છે એમાં? સ્નેલ.
સર આપણે ચાલુ કરીએ.
Yes, we'll do all the settings for the next session. You guys can see him, right? He just cannot see himself. He can see everybody else. But I guess other videos are off, right? Hetal, Gautami, Dr. Sajala Rupali. Yeah, so we see only 3 people.
એટલે 9 જ પાર્ટિસિપન્ટ્સ આમાં દેખાય છે.
At a time, FCCMA, you will be able to see only 6 or 9 people, as much as your screen allows.
Achha.
Not more than that.
આપણે 15 લોકો છે જોઈન કરેલા.
Okay.
Okay, so if anything, please do tell us here. It is okay because we cannot see ourselves. So
ये साफ करी जरूर ना.
You can just.
Okay, sir, your voice is improved. I think
improved,
volume વધારી દે. Yeah, improved.
વોલ્યુમ તો ફૂલ છે અત્યારે.
હા. તો મેં મારા ઓર્ડર પર વોલ્યુમ ફૂલ કર્યું.
હાણે બે કરો.
Okay. Take minute. Hima, please excuse that. Okay, Daddy, can you please let that be?
Okay.
Here. Do not fidget, please.
Okay, feel.
Thank you so much.
હાણે બે કરે નથી હોય ને.
Now,
so we have a small kid with us who's the youngest of us all, and he's 70 years old, and he needs to be taught, okay, you don't have to fidget with the gadget.
He's so playful right now, fidgeting with this, and I was literally trying to touch karo. He's really trying to get it. So excuse us, guys. So you all can start with the session.
Light for me.
Okay.
Sir,
yeah.
So most of the participants over here, they have come to your clinic and they have seen you do the clinical examination. So can you tell us when does actually the clinical examination start? Last time we were speaking about doctor-patient relationship. That time you mentioned something about doing clinical examination. So when does it begin actually? Can you throw us some light on that?
Namaste everybody. Good evening. Hope everybody is ready. And
yes, good
we
evening,
are flying
sir.
to the next level. Good evening everybody. Now we are flying to next level, and this is very, very important before we undertake any patient. First lecture, it was only doctor-patient relationship, which is not there in the textbook so much. So also clinical examination is also not mentioned in the textbook. But without that, we cannot proceed with the patient's problem and the treatment. And here is a platform where we can definitely work on clinical examination, how to arrive at a diagnosis, and what aid is helpful for our diagnosis. Unfortunately, nowadays, clinical examination is almost getting diminished in the medical fraternity. And people have now trained to get acquainted only with the investigations and the reports. There is no clinical diagnosis. And even if somebody makes proper clinical diagnosis, nobody would believe, because there is no proof about the diagnosis on clinical grounds. But still, clinical examination is so helpful, and clinical diagnosis is so helpful, where other investigations may not give us 100% proof. Here we go with the clinical examination. Everybody knows, and many of you must have done clinical examination with every patient of yours. Here something, clinical examination, we start with blood pressure with every patient, blood pressure. Then we go for the pulse, then with oximeter, SpO2 and pulse. Then we go clinical examination from top to bottom, from the hair, then the skin, then the eyes, nose, oral cavity, face, then throat, then spine onwards, different joints in the upper extremity, then the lower extremity, different joints. This is the layout of our discussion for today. So let's begin with the blood pressure. Now BP of every patient we check. If it is normal, well and good. If it is not, high BP or low BP. High BP, we look forward what is the cause of high BP. The causes of high BP either with symptoms or without symptoms. Hema, બરોબર દેખાય છે? Okay. Either high BP if with symptoms or without symptoms. If without symptoms, all the more we have to be very careful, because without symptoms, high BP, body has already adjusted to high BP, so patient could be having hypertensive left ventricular failure or left ventricular hypertrophy. But if the time permits, in a prescribed period of time, that high BP should be noted properly and follow the patient with a repeat checkup of high BP with proper medication, and try to find out the cause of high BP. Now, if most of the times the cause is found to be either at psyche level or with a body level. If hypertension is arising from some stress level, incomplete sleep pattern, or exertion, that BP you should wait and watch and give proper treatment for the cause, and recheck the BP. Eventually, if within a week or two, if BP comes down slowly, you have won the battle. Without any antihypertensive medicine, you can bring the BP to the normal level, and it can remain normal all throughout. This is the one point where, if that patient is put on modern medicine for antihypertensive medicines, then patient probably would be all the whole life he would be on the medication. As far as low BP is concerned, high BP also indicates, you have to rule out hyperthyroidism, then suprarenal tumors, then cardiomyopathy. Low BP, hypothyroidism, and where cough is predominant. In that case, BP can go down, and there can be bradycardia. And here we have to see if the patient is symptomatic, syncopal attacks. Then we have to examine the patient from investigation point of view, and if it is found to be real problematic, then one has to go for pacemaker treatment. You have to refer the patient to the higher centers. This is as far as BP is concerned. Now coming back to the pulse,
Sir,
again
sir,
tachycardia, bradycardia. Huh?
sir, before we proceed ahead, how do we look at this BP when we are doing the clinical examination? BP when we have measured it. Basic point when you said low BP, we understand it is Kapha.
Yes.
Yes. Now, is it always only Kapha avrodhatma? It could also be Vayu and Pitta. So how do we assess that?
Most of the times, I'm saying most of the times it is associated with cough or with Kapha and Vata. Very rarely it could be associated with Pitta. It is also true in high BP uh, there is Pitta and Vata or Pitta alone. In low BP, you have to also rule out the possibility of Samavastha. Many times, because of Samavastha, in both in either case of high BP or low BP, if Samavastha is there, you try to correct the Samavastha with appropriate. Yes, Avdut?
Sir, I have a question. Can I ask? Good evening, sir.
Good evening.
Sir, you told that in low BP it is avrodhatmak samprapti of kaph, but when there is avrod due to kaph, then Vayu will exert more pressure, no, sir? So the cardiac output means there is peripheral resistance, but when the Vayu will give more pressure bilaterally, so due to that pressure the BP should rise, no, sir?
No, it is Kapha Avrutavat. You
So
have to
please
treat cough.
explain. I don't know this.
You have to treat cough or maybe Amavastha. So once Amavastha gets to Niramavastha and treat the remaining cough, then probably BP can be corrected without any hypertensive or hypotensive medicines.
And
You
sir,
have to
in
also
rush
confirm.
there is also low BP when there is rush.
Yeah, you're right. In Rasakshay also there is low BP. So treat the cause. So don't put the patient on medication. Wait and watch and review it periodically and then find out the cause and treat the cause and correct the problem in a prescribed period of time. Don't jump to the conclusion for any medication, allopathic medication. Any other question? Yes, Hema?
Sir, please continue. We will ask questions at last.
Yeah. Now, as far as pulse is concerned, again, pulse either normal or pulse is high, pulse is low. In high pulse tachycardia, please find out if there is any VTAC or atrial fibrillation. Be careful. If it is so, then treat the patient accordingly to save the patient's life. Or in tachycardia, there is always the Pitta or Pitta Avrutta Vata. So Vata also behaves like a Pitta and there will be tachycardia. So cause of tachycardia, find out and treat the cause. It could be deprivation of the sleep. It could be some stressful situation, or patient may be in a agonizing condition, some other problem in the body, and there will be tachycardia. So treat the cause. Again, don't jump to the conclusion and treat with the modern medicine. Most of the times, I have seen many of the patients, tachycardia settles down in due course of time. Otherwise, if it remains continuously high, then you may have to think in higher orders.
Okay.
Then there may be missing pulse. In missing pulse also, get the patient tested for Holter monitor and find out if there is missing pulse. Then Wenckebach's phenomena or some other conditions where patient may need modern medicine. But you have to consider as Samavastha and treat the Samavastha.
Okay. Sir, now when does this clinical examination actually start? Like when do you start examining the patient? Does it start
Once
when he
patient,
sleeps on the bed, or how does it start?
once patient is given warm welcome, ask the patient to settle down. You may examine while sitting. Ideally, a patient should be lying down on the bed, and assure the patient that you are going to have only clinical examination, and then we'll find out the final diagnosis and then the treatment. And then you can start clinical examination. And starting should be right from top to the bottom, from the hair down towards the toes. So we go phase wise in the body. Starting from the hair, either you get baldness, that is Vata and Pitta, or there is scarce hair, graying of the hair, thick hair, black hair. Thick and black hair indicates excessive Kapha, and gray hair indicates excessive Pitta. And age-related changes in the hair is different thing. Again, it is Vata-dominated graying of the hair and baldness. So, and in the scalp, you can also see, find out, if there is any skin infection, psoriasis, or dandruff, simple things, only by examining the hair. Any problem with the hair? Many times you may get, side effect of the allopathic medicines where the hair root doesn't get proper nourishment, and like, patient undergoing treatment for the cancer, so patient may lose the hair. It may be temporary, it may be permanent. Next, we come down to the face. Look at the skull, look at the forehead skin. If it is sticky, this, if it is sticky, it may refer to excessive cough or samavastha. If it is dry, then it is vata. If it is dark discoloration in the skin, it could be pitta. I can give one simple examination. I have seen one patient recently, 15-year-old girl had darkness in the forehead and the facial skin. I gave Pradhaman Nasya, and within 10 minutes, this dark discoloration vanished, and it was seen by the mother and the grandmother within 10 minutes. So that's a darkness of the skin indicating Pitta Avastha. And sometimes you may see leukoderma patches. So that also, and see the border of the patches and the base of the each patch distributed in the skin, in the whole body. And this is what you have to reassess every successive time. Then comes the eyebrows. If there is a thick eyebrows, that indicates kapha. That patient is quite stable in the thinking process. If eyebrows are very sparse, or there could be drug reaction, or there can be excessive vata or pitta. Then we come down to the nose. Look at the skin over the nose. Look into the nasal cavity. If excessive hair growth in the nasal cavity indicates kapha, if there is slight discharge from the nose, it could indicate pratishay, where patient requires pradhaman nasya. Or if the look for the septum. If there is deviation of the septum, DNS, there will be unequal pressure across the septum. Don't treat it surgically. So many patients have undergone treatment for the DNS, but there can be recurrence of the DNS. So it doesn't require any surgical treatment. This can be treated even without surgery with Ayurvedic medicines. Then comes polyps. You have to look for the polyps. These polyps can be contributing factor for sinus or from the sleep disorder or sleep apnea. So also uvula and in the mouth. You have to look for the tonsils. Look for posterior post nasal drip. Look for the tongue. If it is pale, if it is red, if it is uh, uh, brown, it indicates different doshas, Vata, Pitta, and Kapha. Treat accordingly. Look for the ulcers in the mouth, in the tongue, for stomatitis and glossitis, and come down to the throat area. Look for the lymph nodes, submandibular, submental, cervical, and posterior cervical, which indicates either lymphadenopathy or tuberculosis or some growth. Look for the thyroid gland. If it is palpable, you assess accordingly. Then come down, see the notch, suprasternal notch. There also you try to find out any swellings. Supraclavicular nodes, it could be secondaries to the lymphoid tissues. Then come down to the neck area. While examining, we ask the patient or we lift the head of the patient in the flexion position. If there is slight stiffness, patient won't be able to lift it up to 100%. Then you start suspecting there is any pressure in the cervical spine, maybe in the form of cervical spondylosis. There was one patient where we found the lifting the head was heavier in a 15-year-old lady, in a girl, 15-year-old girl. Lifting the head, flexion of the head was heavy. We thought it could be samavasa in the brain. There was a stunted growth. The cause was anterior pituitary adenoma, and that indicates there is a samavasa in the head. So we gave nasya, and after again 15 minutes, the same head which was heavier now has become lighter in within 10-15 minutes. So this examination gives us extra, which MRI will not so much correction, but clinical examination gives us the cause and treat the cause and see the result. That is, as far as cervical spondylosis is concerned, you may find a radiculopathy on either side, either right side or left side, or both the sides. We give postural correction for the cervical spondylosis. Even if there is vertigo, the postural correction can be corrected. So look look at the neck, do flexion, you can do extension, lateral rotation on either side, or tilting of the head on either side. That will give us the range of movement of in each position of the head. Accordingly, clinically you can find out which part, C1, C2, C3, C4, C5, C6, which part is affected, and where is the tingling numbness in the hand. So accordingly you can give the corrective postures and nasya chikitsa. This is as far as cervical spine is concerned. Coming down to trapezium, trapezoid muscles, and shoulders. In there you can find either stiffness in the one shoulder or both the shoulders. There may be restrictions in the movement, different movement of the shoulder. Patient either has undergone shoulder corrective surgeries. Again, there may be recurrence, or you can treat the shoulder problem with a postural correction, and the result is instant. For frozen shoulder, particularly, patient may have undergone physiotherapy for several months or surgery once or twice, doesn't give any result. Sometimes, then you can give postural correction, and the result is immediate. Some patient might have taken injection in the shoulder joint, and to find out correct the rotator cuff problems, but corrective measures, corrective postures, and nasya gives excellent results. Then comes the arm and forearm, and find out the musculature, biceps, triceps. Then the elbow, find out if there is any tennis elbow. There will be tenderness in the elbow. Come down to the forearm, and then the wrist. You may find some swelling or inflammatory changes in the wrist in case of osteoarthritis or rheumatoid arthritis or some other septic arthritis or some fractures. Try to correct that. Then comes the fingers. Before that, there may be interossei muscles. If there is wasting of interossei muscles, find out if there is any carpal tunnel syndrome. Patient,
वो मेरा पंचकर्म चल रहा था.
everything's okay. Look for carpal tunnel syndrome. Patient might have taken injection in the carpal tunnel or undergone surgery for the carpal tunnel. And here is an easy treatment in Ayurveda for carpal tunnel syndrome. Then comes the fingers. Look for the movement of the fingers of interphalangeal joint or metacarpophalangeal joints. In case of osteoarthritis or rheumatoid arthritis, any other kind of problem, and that also can be corrected with the Ayurvedic medicines and postural corrections. Then comes down these nails. Look for the nail bed. Look for the striations in the nail. Look for the peronechia. Look for the ingrowing nails in the fingers as well as in the toes, and that also can be corrected. Coming down to the chest area, find out the ribs, the movement of the rib cage, costochondral junctions, particularly in the muscle. Costochondral junctions in case of muscular pain. Patient may complain of chest pain. We may think it could be cardiac problem or it may be something else. Find out and just have tenderness. Find out the tenderness in the costochondral junctions, and it can solve the problem easily. We usually give strapping for the chest, either a crepe bandage or adhesive bandage can solve the problem. Only thing, precautions should be taken that strapping should be done in expiratory phase, not in inspiratory phase, when the result is instant. Keep it there for 2 to 3 days and patient can resolve the problem. Then comes the abdomen. We know divide abdomen in 9 different quadrants. Each quadrant has got its own role. Particular organ is situated in that particular quadrant. You have superficial palpation. Find out whether there is any tenderness or fullness. On the right side, it is liver and the gallbladder. In the epigastric region, it is the body of the stomach, fundus and body of the stomach, and pylorus. In epigastric, we divide into 2 parts: upper epigastric and lower epigastric. If there is tenderness in upper epigastric, there can be possibility of gastritis or gastric ulcer. In lower epigastric region, if there is tenderness, it is pylorus that can give either duodenal ulcer or duodenitis. Further left side is the spleen and left flexure of the large intestine. Then comes the right renal angle, left renal angle. Find out any problem with the kidneys and the fundus of the kidney, ureter, and the down below ureters. In the umbilical area, either there is infection in the umbilicus or umbilical hernia. Find out there is any. We can confirm this with the SLR test. We'll come down to that point little later. Find out in the both the iliac fossa if there is tenderness in the right iliac fossa, suspicions of appendicitis or typhlitis, that is inflammation of the cecum. Then comes the left iliac fossa that indicates the problem in the pelvic colon, and further down cecum, further down in the anus. Hypogastric region, in case of female, it is the uterus, ovaries. In case of male, it is ureter, it's urinary bladder and prostate. Many a times you may find some swelling or tenderness in this region that indicates there is problem with the urinary bladder. In case of cystitis, chronic cystitis, or secondary to prostatic cancer, there may be fullness of the bladder indicating there is residual urine, and find out accordingly with investigations. Then coming little lower down is find out the inguinal hernia on the right and left side. If there is swelling, then you may confirm with the inguinal hernia and treat accordingly, or send the patient for the surgery if required. Coming down is a thigh area, hips area and thigh area. Hips we can find out little later in SLR test, and thighs you see whether there is any wasting of the muscles in case of some arthritis, or in case of avascular necrosis of the head of the femur, where the muscles are not acting properly because there is hardly movement because of stiffness of the joints. So muscle wasting. Then coming down to the knees, find out if there is inflammatory changes in the knees, either osteoarthritis or rheumatoid arthritis, septic arthritis, Charcot's joint, where there is cancerous changes in the knee joint. Most of the knee joints doesn't require any treatment, surgical treatment. Then this can be done with the medicine as well as with the postural correction. Patient can start walking comfortably well in first visit of treatment. Patient can walk comfortably well. With number of days the patient follows this same treatment, patient can be saved, from surgery. Coming down to the calf and the leg, shin bone. Calf, if you find there is tenderness in the calf, this indicates there is urgency in passing motions, where calf muscles are really very hard and patient can toss in the bed at night. There is something like uh, legs only. Patient may have pain throughout the leg, shin bone, and that also indicates that many a patient complains of tendo Achilles tenderness, which indicates many a times patient has to undergo surgery. In US they do surgery on tendo Achilles, but it doesn't require surgery. Is absolutely not required. It can be corrected with medicine and postural corrections. Then coming down to heel area, where you may find calcaneal spur. Again, they may give injection or they perform surgery. That is also not required. There can be recurrence, and with the help of Ayurvedic treatment and postural correction, that also can be corrected easily. Find out any ankle mortis problem. In case of inversion and eversion, if there is any tenderness, you have to treat accordingly. Then coming down to metatarsopharyngeal joints and interpharyngeal joints, and if there is any swelling like in high uric acid, then you have to find out tenderness in the great base of the great toe, and then find out whether there is any infection in the toes. Then it could be scabies, it could be fungal infection, and treat the things accordingly. Then coming down to examining the whole lower extremity with SLR. This SLR gives lot many information. With one leg straight leg rigidity test, if it goes up to 45 degrees, you may find the problem in the hip joint, or it can be because of the stretching in the posterior group of muscles of the thighs and the legs, and then individual joint, and then both the joints together indicate there is some problem in the lower lumbosacral spine or hip joint. So that can be concluded with the arthritis part. Then very important is gait examination. Many times we forget to check the gait, particularly in case of lower extremities arthritis. So find out the gait. I have taken so many cases, recordings, video recordings of the gait before treatment and after treatment, and there is instant change, positive change in the gait of so many conditions. Spine, from cervical we have described, now down below thoracic spine, and if there is any gibbous formation, or if there is any kyphosis or scoliosis or ankylosing spondylitis, there will be stiffness. So that also can be assessed and treated accordingly. Now down below, greater trochanter, if there is tenderness, there could be synovitis or changes in the, I forgot the name particularly, bursitis, very common. It's not in the joint itself, but bursitis, which can be, you give anti-inflammatory drugs in Ayurveda, and patient can get correction. This is as far as gait part is concerned. And then ask the patient to lie down on the stomach and try to give flexion of the knees. That will give another information. And again, arthritis can be confirmed with the same posture and give correction. Any question? One point I would stress for all of you, all this, whatever we talked about, this examination can be done just within 1 minute. From top of the head till the toes, total examination would not take more than 1 minute. And 1 minute information is more than taking X-ray or MRI of the patient. And this can be done every time patient comes to your clinic.
Sir, SLR test you do for each and every patient and in each and every visit. So how do we interpret it in Ayurvedic way? What is the Ayurvedic interpretation of this SLR test?
That gives some stretchings. Patient gets the stretching in a particular group of muscles. Anterior group of muscle, posterior group of muscles in the thigh level, at the calf level, and the ankle. And adduction and abduction, internal rotation and external rotation. So that gives fair idea about the individual joints in the lower limbs. There is an additional information can be converted into Ayurvedic terminology. We have done in modern medicine.
Sir, this was regarding a quick clinical examination. You have told multiple points. So can we go into detail of each organ examination? Like
Yes.
When you do the spine test, when you do the punch on the spine for the patient, what do you exactly assess when you are giving a punch to the spine?
When we give punching action at individual vertebral level, wherever there is tenderness, right from the cervical spine to the lumbosacral spine, wherever there is tenderness, so there could be inflammatory process going on in that particular level vertebra. So then find out whether on the left side of the vertebra, right side of the vertebra, on the top of the vertebra, or the lower end of the vertebra. So one vertebra at four different angles, you find out if there is any problem with the vertebra, if there is a compression fracture of the vertebra, or there is a pinching of the nerves at particular left side or right side of the vertebra, or there may be a problem with the different ribs in the thoracic vertebra. So that will be useful even in herpes zoster. Post-herpetic neuralgia patient may get, in a thoracic examination. There could be gibbous formation. Gibbous also indicates tuberculosis of the spine. And localized inflammatory changes, infective changes in the spine.
Okay. So how do we understand this gibbous or these malformations or these tenderness into Ayurvedic terminologies? Whether we consider this as a Samavastha, Niramavastha, or it's a Pachamanavastha, how do we understand that?
It is arisen from Samavastha. Either Vata Samata or Vata Kapha Samata. It could be Pitta Vata Samata. Anything is possible depending on the etiology, Samprapti. There may be different presentations.
When you're doing the SLR examination, you also check the calf of each and every patient. So what does the tightness in the calf mean?
Tightness in the calf indicates there is either urgency in the motions, there will be tightness in the calf, and patient may be rolling over in the bed because of the pain and tenderness in the calf. There could be sick, uh, uh, restless leg syndrome, described as restless leg syndrome, which warrants surgery in Western world. While here in Ayurveda, within a week's time, it can be corrected 100%. So also, tendo Achilles, it can be corrected very easily by correcting the gut. So majority of the problem starts from the gut. From either there is problem in the uh, uh, any of the either uh, celiac syndrome or duodenum or the large intestine.
So Dr. Anju has asked, there are night cramps sometimes. What does that indicate? Does that correlate to the calf tightness?
Most of the time it indicates there is urgency in passing motion. There is excessive Vata generated in the calf, which gives tenderness, and patient keeps rolling or keeps hitting somebody lying beside that patient.
Okay.
That is
There
pure Samavastha.
Pure Samavastha. Okay. Sir, when we are looking at the patient, fairly enough, are we really looking at the person's prakruti, or we are looking at the patient's vikruti when we are doing the clinical examination? What are we actually looking at?
Patient has come as a patient, and we have to see as a pathological part, vikruti. But while looking for the vikruti, you have also to use the basic patient's body structure and try to connect both if it is possible. The diagnosis samprapti would become very easy, and treatment would become still more easy.
Okay. So we remember at certain point of time that you had taught us how to do examination, prakruti examination of a newborn baby who's in, just tied into the. So how do we judge a newborn baby's prakruti or samavastha nidamavastha?
It's very delicate. First of all, look at the eyes. If the eyes are rolling very fast, it could be Vataj prakriya, or child has a recurrent respiratory infection, upper or lower, or running nose, every now and then fever, and child becomes restless. And recurrent infections can go in favor of Kaphaj avastha, Kaphaj vikruti. And child is very much restless. It could be Vataj vikruti. And child doesn't like heat, or doesn't like to be covered. Probably it is Pitta's prakriti. And depending on the color of the skin, color of the tongue, one can decide about the prakriti of the child. And how much feed, how fast child is taking the feed, how often the child is taking the feed, that also would decide Kapha and Vataj prakriti. And from the sweat, if the sweat is yellowish discoloration, then it could be Pitta prakriti, like in adults.
Okay.
And if the sweat is sticky and smelly, it could be Kaphaj or Samavastha of Kapha and Vata. As I told you
Smelly
earlier,
and sticky sweat is samavastha of Kapha and Vayu.
Kapha or Kapha and Vayu, or Sam Kapha and Vayu.
So what about the sweat of a Pitta prakriti person? Doesn't that also stink?
It will be sticky. It will be sticky, smelly, and yellowish discoloration. That is Pitta prakriti. the clothes of the child with coverings, if they get yellowish discoloration, it could be Pitta's Prakriti.
Okay. Uh, Sir, I have seen in the clinic that you do a lot of analysis before starting the clinical examination. You even check patients' handwriting in the diary. So, what do you understand by examining patients' handwriting?
See, my habit is when the patient comes for the first time, we take the patient's details, full name, address, age, contact number, email address, and who has referred the patient to me. So this is actually, we have some reference about the patient's residence, where he is coming from, which area is coming from, what is the kind of that area. And from the handwriting, we come to know whether patient is Vata Prakriti, Pitta Prakriti, or Kapha Prakriti. If patient writes very slowly, easily, comfortably, then it is Kapha Prakriti. If writes little faster, it is Pitta Prakriti. And doctors writing usually are Vata's Prakriti, where you cannot understand reading. Actually, you cannot read it properly. It is Vata's Prakriti. Just from patient's handwriting point of view. I have not mentioned this earlier, but this is also very important. We insist that patient only should write his own details, not the somebody who has accompanied the patient. It may take 1 minute's time, but by the time patient has written down his details, our diagnosis is ready. As the patient enters the clinic, how he enters, how he watches around, how he looks at you, and how he's sitting down on the chair, you can make out the prakriti of the patient.
Okay. Sir, there are certain questions in the chat box. I will take those and then we can proceed further. Dr.
कैमरा पर हाथ
Oh, sorry.
Yeah.
એમાં હું જ નથી દેખાતો ને સ્નેહલ.
Okay. Sir, there are questions by Dr. Aman. She's asking that how does Samavastha lead to low BP, and what does Ayurveda consider BP as? I mean, what can we consider BP in Ayurveda?
In Samavastha, particularly Samavastha of Kapha or Samavastha of Pitta. Samavastha or Kapha can lead to low BP, bradycardia. Samavastha of Pitta leads to hypertension and tachycardia. So treat the things accordingly. And best thing is, by Nasya. If it is related to the brain or rather the mind, if patient is sober, patient is fragile, patient is depressed, then he will have Kaphaj Prakop. And if the patient is hyper excited, restless, would go in favor of Pitta or Pitta and Vata Prakop. And treat the things accordingly. By giving Nasya, immediately patient would respond and patient can become sober down. This we have seen in many of the patients every day.
Okay. So there's a question which is asking, there are serrations and black margins on the tongue. What do they indicate?
Come again.
What do we interpret? There are serrations on the tongue. There are black marks. Yes. There are certain times brown spots. There are certain times red spots. Sometimes the papillae come up like beads. Sometimes the tongue is bald in certain areas. Sometimes the whole tongue is completely bald. So how do we interpret this?
It is also termed as a geographical tongue, where there are different, like moon surface. the pits and that's in that over the tongue, and very irregular margins can go in favor of Vata. Reddish or reddish bulle, reddish spots can go in favor of Pitta, and yellowish or whitish tongue can go in favor of Kapha. Many times you also see the red spots inside the cheeks, like ulcers in the mouth. Caphthous ulcers in the mouth indicates either B12 deficiency or excessive pitta or Zollinger-Ellison syndrome.
Sir, uh, what do we do for the? What do we interpret this as? A patient not able to hold urge of motions even for few seconds.
That gives Apanavayu or Samanavayu dosha, where there is urgency and maybe sticky stools, and he may pass some undigested food materials in the toilet. This is very common by the time patient reaches you for the treatment. He has already undergone through so many doctors treatment and investigations, including endoscopy, upper GI endoscopy or colonoscopy to find out the cause, but sometimes the cause is not available so easily, and here with urgency of the motions, and we can treat it very efficiently.
Okay. So there is a question from Dr. Sunaina Borgaonkar. She's asking what kind of laxatives you prefer according to Sam and Niramavastha. Sir will give a short answer, but we are going to have a detailed lecture on how to decide what to use when you have a Samavastha and when you have a Niramavastha of motions. But sir will give a chotu answer right now. We are left with only 10 minutes right now. So sir, thoda nano answer.
Okay. See, there can be alternate constipation and diarrhea. Sometimes constipation, sometimes diarrhea in same patient. At different timings, there may be different phase. So that would indicate, there is problem with the sangrahani, either Vata sangrahani, Pitta sangrahani, Kapha sangrahani, or the combination, dosha sangrahani. So you treat with the appropriate. Uh, uh, any problem? You treat the sangrahani accordingly, where you can correct the stickiness of the stools and urgency of the stools. Then there may be hardness in the stool. If stools are dry and rough, and patient has to exert pressure to expel the stools out, it is purely Vata's prakriti, Vata's dosh. You treat this kind of constipation with the help of any laxatives. Particularly, patient requires lubrication. This lubrication either with snigdha dravya, either in the form of Sanskrit milk or tail or ghee, and castor oil. That is as far as dryness of the stools are concerned. And rule out any fissure or fistula created by the constipation of this particular group of patients. There is another condition where patient may have only sticky motions, and it may take prolonged time to pass the motion. Here also there is samata in the stools, where patient requires particular deepan and pachan. There is one condition called as SMA syndrome. I have seen 4 or 5 cases of SMA syndrome, where
Sir, what is that?
in superior mesenteric artery syndrome, I have seen almost 5 cases of SMA syndrome, where there is no successful treatment available in modern medicine, and patient may have to undergo surgery for SMA syndrome, which may not be successful. Here we consider only Grani and patient gets all right. Depends whether it is Pitta's Grani or Vata's Grani or combination of the doshas.
Okay.
Any other kind of stool problem?
Sometimes some foods can cause sticky stools. Nature of stools can change for few days also. Isn't it in a healthy individual? This is a question by Anju.
That all depends on what patient has consumed, what food patient has consumed, and what time patient has consumed the food. If it is late night, then you may have to consider that the timings of the problem. And if it is heavy food, that also depends. Patient has restless night or sleep deprivation, then also stools consistency will change, but it may be temporary. But if it remains permanent, then you have to find out the cause and treat the cause.
Okay.
One point we have to clear with every patient nowadays. If patient says he takes more than 10 minutes, 15 minutes, or sometimes half an hour, I've seen patients. Just find out patient has gone to the toilet without any gadgets, no magazines, no mobile, because he would spend more time in the toilet where outside he may not be allowed to use that gadgets, particularly in children's case. So without mobile, without magazine, how much time patient is spending in the toilet? That also would decide, what kind of constipation patient is having. It may not be actual constipation. Reassure the patient and problem will be solved.
Now, we can take a last question. 27 already.
Okay. See, all questions related to stools now we will take when we are doing the whole Malpariksha thing. We will take a complete another lecture also for complete abdominal examination in detail. There will be questions. There is another question about nails. If there are white spots on nails, can it be because of only krumi in children, or does it indicate something else?
Some vitamin deficiency also, krmis also, and poor hygienic conditions of the patient, or fungal infection in the nails. Very common fungal infection.
Okay.
Difficult to treat.
Okay. And there is another last question I'm taking. Young girls develop palpable lymph nodes on sides of neck.
Majority of the times it could be just simple lymphadenitis, inflammation of the lymph nodes. Consider this as some of Kapha or Kapha and Vata and treat it accordingly. But in some cases, it may indicate tuberculosis. Just examine the patient investigate the patient from that point of view. Sometimes patient may have, Virchow's nodes that indicates cancer situation in the neck. Then scrofula. Hello, am I audible?
Yes, sir, you're audible.
So different presentation or lymphomas, very common. Lymphomas are very common. We are seeing either side of the neck in anterior and posterior cervical triangle, or maybe in the clavicular region. Then you find out the USC or CT scan for further investigation present above the diaphragm or below the diaphragm. Depending on that, you can have staging of the lymphomas. It is also getting quite popular now, very common. So nowadays lymphomas can be treated easily, whether as far as lymph nodes are concerned. But commonest condition in younger age group is tuberculosis. Don't forget the possibility of malignancy.
Okay. As a small thing that you all can start observing and doing the clinical examination, as sir has said, to take away one point which you can start noticing on the tongue. If you have spots on the tongue, I'll post a picture on the group. What you all can do is, it is very, very easy and extremely easy to find out krumi just by looking at the tongue. So I'll post a picture which has particular spots. So if you see the papillae rising up like that way on the tongue, you know that it is krumi. You don't have to search anywhere for any other symptom also. Then you can just reconfirm with all the other clinical symptoms that you are getting. So with all the things that sir has told today, just one thing that you can start looking at in the patients is this, that you check the tongue, look at the beads or the papillae, how they are forming up. You can also make out whether it's a Purushash krumi, whether it's a Raktash krumi, whether it's a external krumi. That you can very easily make out. Just a minute. So we'll post 2-3 pictures so you can make out. We'll talk about in detail discolorations, the serrations, the swelling of the tongue, the teeth mark, and everything. For individual, each organ also will take all the certain examinations and how to interpret everything according to Ayurveda. So for krumi, one small thing that we will be posting this week. And whatever sir has said, uh, this whole 1 hour, whatever has sir has said, it's just an examination of 1 minute. And I think those who have visited sir's clinic, they know that sir does all this only in one or 2 minutes. He just finishes off everything. It's not a बोलने के लिए इतना लंबा लगता है, ये भी देखना ये भी देखना, लेकिन देखने के लिए बस वो नजर चाहिए, 1 मिनट में ये काम हो जाता है.
समझने के लिए और ज्यादा टाइम लगता है. I forgot to mention, you have to find out even the possibility of tenderness of the temporomandibular joint. That would indicate some problem with the teeth. Either there is malalignment of the teeth, then refer the patient to appropriate dentist. If there is any erosion in the temporomandibular joint, or maybe because of the arthritis, TM joint is involved. So don't forget to examine the TMJ. Eyelashes, if there is ingrowing of the eyelashes, like in trachoma, there will be constant irritation of the sclera because of the interned eyelashes. So very simple. Just if you can find out trachoma, you can just
I think sir has lost network.
Dr. Aman Kaur has raised her hand. So if she wants to ask anything.
Good evening, sir and ma'am. Sir, I basically wanted to ask, before we proceed further, can sir elaborate about what exactly is Samavastha? Like, he's just seeing the patient and just saying that it's Samavastha, whereas we think about lot number of sampraptis and how the cuff is acting, and then we come to the point that it is Samavastha. So what exactly, just by looking at the patient, sir tells it's Samavastha or Niramavastha. So what is sir's point of view in Samavastha and Niramavastha in gross? That I wanted to ask.
સર તમારો અવાજ નથી આવતો. મ્યુટ હશે. સરનો અવાજ આવે છે?
સર નથી આવતો. સર તમારો અવાજ નથી આવતો. સર એક્ઝિટ કરીને પાછું જોઈન કરો, અવાજ આવી જશે. સર એનો ઓડિયો ડિસ્કનેક્ટ થઈ ગયો છે. Only the picture is connected.
Yes.
રિમૂવ કરી દો સર ને સર પાછું જોઈન કરશે.
હા, right.
Remove.
મેડમ થોડી આઈડિયા આપી દો કે નેક્સ્ટ સેશનમાં આપણે હજી ડિટેલ એક્ઝામિનેશન લઈ લઈશું.
કહી દે ને, તું કહી દે. સર આવી ગયા ને? સર જોઈન તો થયા.
હવે આવે છે અવાજ?
પરફેક્ટ અવાજ આવે છે.
Any question, Hima?
Sir, there are questions, but I think we will take more time for each question. Like we will be having detailed again examination as per in Ayurvedic context. So basically, I will like to tell every participant here that basically for the per abdominal palpation and
સર અવાજ
examination. Okay. Is it audible now?
better.
Yes.
Yeah. So yeah, for every participant that there would be very many questions about every examination, and mainly from Ayurvedic context. So we will be having detailed examination point of view for per abdominal, then SLR, then spine, and the skin, where that is the method sir generally used in his clinic. So we will be having that in detail for each part or each examination per se in the coming weeks. Yes sir.
Okay.
Okay sir.
સર અમનનો જે ક્વેશ્ચન છે કે તમે સામાવસ્થા ને નિરામાવસ્થા કેવી રીતે ડિસાઇડ કરો છો, and what do you look in સામાવસ્થા and નિરામાવસ્થા? It's a question which will take a long time to answer, so I think we take it in the next session. So then you can. Okay. I think Aman, that's okay, right? We can have a session next
Yes, ma'am.
So that
Yes,
is
ma'am. Totally
answered
okay.
completely. Yeah.
Yes.
Only
Yes,
one
ma'am.
point, since someone has asked this question, which can be taken later on, but easiest way, find out that patient is getting Guruta or Lagavta. If there is Guruta, it is Samavastha. It is Lagavta, Niramavastha. Simple. Rest of the things can be discussed at appropriate timings. This is in short, clinical examination which would help us in arriving at an appropriate diagnosis, and that would indicate the line of treatment accordingly.
Sir, how we decide Laghuta? Like patient might say that he is having symptoms of Brahma, but he's saying that I feel heavy in my abdomen or after eating food. So, sir, do we decide it at the coastal level or like how? Like in some body part he might have Guruta, in other thing if he's having something, if he having something like intellectual thing like doctors or teachers, then he might having lagutha in the brain also, but he might having heavy symptoms in the chest or bloating. So how in gross we
See,
can decide that?
most of the times patient wouldn't know whether they have got Lagata or Guruta. It is only when you start treatment on day one, and after that treatment, particularly for Nasya and Aschotan and other treatment, and immediately patient would feel, now I feel much lighter and better and fresher. That indicates it was a Samavastha, but now it has turned into a Niramavastha on very first visit of the patient. Otherwise, he wouldn't know whether the patient is having Guruta. After putting, particular dravya, Nasya, patient feels lightness in the head immediately, and he will say now he is getting Laguta, lightness in the head. So earlier it was heaviness which patient never knew, and that is the comment from most of the patients.
So it is mandatory that every patient comes to the clinic, then we do the nasya and then know how the patient reacts better.
I usually put Nasya in every patient, depending on clinical examination history taking. We find out what kind of Nasya patient is required. So we put the Nasya accordingly and see the change immediately.
Okay, thank you, sir.
Patient with ADHD, for example, very hyperactive. You cannot, you will not know whether patient is having a Samavastha or Niramavastha. Patient cannot even mention. But put the Nasya, particularly Saman Nasya or Brahman Nasya, and patient sobers down within minutes. Within minutes. Converse is also true. Patient who is very dull, very lethargic, very lazy, put some Shuddhan Nasya, and within minutes patient becomes much better. So that indicates Samavastha and Niramavastha. Anything else? Hima, Snail, Avdut?
We can wind up the session, sir. Now, other questions we can take in the next session. Other detailed examination also we can take in the next session. One last thing which I want to add is when I was going to sir, same question I asked sir, and sir said that by default you have to consider every patient comes in the Samavastha itself. You do a testing through Nasya, through Aschotan, through scent fermentation, through exercises. If patient says yes, I am feeling lightness, then we consider that it was earlier a Samavastha which is converting to Pachamanavastha, and then later on it will convert to Niramavastha. So by default you keep in mind in each and every patient that patient comes with a Samavastha and you have to treat the Samavastha. You have to look into the condition according to that and find out if it is a Samavastha or Pachamanavastha or Niramavastha. But keep in mind that it by default comes in a Samavastha stage. And with Uksha and Uksha Chikitsa, you can confirm that it was a Samavastha. Now, with sir's permission, we can wind up the session for today.
Okay. Thank you very much, everybody, and good night.
Thank you very much, sir, and good night to you also.
I don't know कौन बोले थे कौन से
Sir Rupali.
Okay, Rupali. Are we done, Snail?
Yes.